everyone, good afternoon. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is definitely a big concern. Acne is a very common skin condition that can impact everyone. Whether you are a teenager or an adult, this skin complaint is no stranger. Knowing the various types of acne can actually help you to treat the condition better. Acne is a very chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases or condition affecting humanity and quality of life as well. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know about the holistic treatment approach for this ailment. Despite despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounded this very common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. C.H. Deepthi Prasad, live from Karimnagar, Telangana, to talk on importance of sunscreen and acne management. Dr. Deepthi Prasad is Director and Chief Dermatologist at Deepthi Hospital. She has an experience of 14 plus years in this field. She completed her MBBS from Dr. NTI University of Health Sciences, Andhra Pradesh, and MD Dermatology, Venereology, and Leprosy from Osmania Medical College, Hyderabad. She has 3 publications in indexed journal, many paper and poster presentations at different state, national, and international conferences. She is also the recipient of many awards, prestigious awards, and achievements at state, national, and international level. She is co-author for a chapter in Handbook of Pediatric Dermatology and author for a chapter in Handbook of Dermatosurgery. She has experience in many services like skin allergies, line and wrinkle smoothing, skin boosters, filler, skin allergy treatments, and rut removal, etc. A very warm welcome to you, Dr. C.H. Deepthi Prasad. It's such a pleasure to have you with us today.
Thank you so much.
So, Doctor, today we are talking about acne, management of acne, and plus use of sunscreen for both, prevention as a preventive measure and as a part of the treatment. So, we'll start with acne. Needless to say that acne is so common and almost everyone is, at some walk of life affected with acne. So first of all, we would like to start with what is acne and what are the various types of acne?
Yeah, so as we all know, acne vulgaris, generally called as pimples, it's a very common problem of teenagers especially. But because of changing lifestyle and a lot of stress in each and every aspect of living, we also see acne in adolescent and even adult acne, which is a very latest concept of finding acne on the faces of women during their menopausal age after 30s. So coming to what are the types of acne? So here, depending upon the appearance of the pimple and well as the grading, the severity, we can grade it into 4 types. That is grade 1, 2, 3, 4. Grade 1 is basically fine comedons, the black heads and white heads which we see without any redness. That is grade 1. And grade 2, you have inflammatory papules. In the sense, there will be bumps which are red and a little painful. Grade 3 is even more intense, and grade 4 it is with scars. So where you see a lot of pustules, nodules, and cystic appearance, where the whole face will be studded. And this most commonly we see in boys, teenager boys, that special sect of boys with excessive testosterone dominance. So as we understand that this is a teenage problem, so hormones play a very important role in triggering acne. And also the second thing, your oily nature of the skin. So oily skin, combination skin are more prone to develop acne, which is in turn because of the skin type they have. And also it is also related to your dandruff issues, because everything is a spectrum of sebum production. So more the oiliness nature of your skin, and the oiliness will be the maximum in the body on face and scalp. So there is an association with dandruff as well as acne. So this is the types and the main reasons for acne. Yeah.
Right. So you have very well explained, Dr. so far, that what is acne, what are the various types, and what are the common causes. If we talk about the risk factor, who are at risk for these acne, doctor?
Yeah, so once again, the same thing, teenagers. Say it may be a male or a female, but most commonly because of the hormone testosterone, which starts peaking in the adolescence, when the teenage actually starts, the hormone starts appearing. And in few girls also, we notice that girls around 10 to 11 years, 9, 10, 11 nowadays, they come up with pimples on the acne. So that is an indication that your body started your hormones, out of which the testosterone is the main hormone. So risk factors are these things. One is age, and second thing, oily skin. And if you talk about adult acne, which is little different from regular acne. So here the distribution and the type of the pimple we see, it is little different. So how is it different? Most commonly we observe the acne around the lower face, around the jawline. So upper face and middle face are relatively spared. And these bumps are little painful and they have premenstrual flare as well. So in such individuals, we have to suspect that there is some kind of hormonal imbalance that is happening in that particular female. So this is called as adult acne, which is very common nowadays because of changes in lifestyle, and there's a lot of hormonal disturbance that is happening, and there is a kind of predominance of male hormone and less appearance of female hormones. That is testosterone is predominating than the estrogen, so which in turn is indicating that your body is undergoing a kind of imbalance. So that is also one more important risk factor, you can say, that hormonal imbalance and PCOS. And as I told you, dandruff issues also can cause this particular thing. Yeah.
Okay, so basically we can broadly say that age or hormonal imbalance or change, and plus your skin type, if you have a combination or oily
Yeah.
or you have dandruff, etc., then of course you're more prone to acne.
Yeah, and one
Doctor,
more thing we can
yes.
add here is the nowadays, especially in women who are little skincare conscious, people tend to use a lot of products which are not suiting to their skin. So
Right.
that is one more important thing where you see there will be blockade of the pores. So we know that the face is full of pores on our through which the oil is produced by the skin. So when these pores are blocked by substances which are very thick, so these are usually called as comedogenic products. So not choosing a product which is suitable to your skin also leads to this thing. And a lot of makeup nowadays, makeup is full of silicons and a thick molecule, so that tends to occlude your pores, and once again you'll be more prone to develop these kind of makeup product induced comedones and acne eruption.
I completely agree with you, doctor, on this, and I'm glad that you bring up this topic of how these days we are using like so many products and experimenting with our skin in a way. Now the thing is, market gimmick is there. There are so many product. Market is flooded with products. Advertisements are there. Endorsements are there. Plus there are influencers on social media, right? And we are also changing our products every now and then. We are using one product for 2 months, then we are buying one few more, and our list is just endless. Now my question to you is, normally we say that it's important to take care of your skin. A basic routine should be followed. Now for acne prone skin, what should be that basic? Do we really need so many products, or we can actually work out or make our skin healthy with minimalistic products?
I understand your question, and this is a very common question almost every patient asks: how to choose the product and which suits my skin. And so for this to understand, you have to first understand your skin, because broadly we divide the skin type into your oily skin, dry skin, normal, and combination skin. But frankly speaking, there is no any hard and fast rule, or there is no any border that exactly demarcates that no, this is your oil, you are normal. It's not like that. Your body keeps changing, your hormones keep changing, season keeps changing, your skin tends to respond in a different way in every season. But broadly, this is what we categorize for just a simplicity of understanding. So I insist upon every patient, my patient, that do not just go to the OTC products. Just don't be carried away by a lot of information. And Instagram is nowadays full of information, and direct click a link and you'll go to the product to purchase it. So this is not something which you have to do, because there are professionals. We have spent our whole lives to understand the skin, and only after such a long studying of that particular aspect of skin, we in the society to help you to understand your skin and to choose your products wisely. So what I insist here is you have to take a professional help. If you really are very conscious about what to use, how to use, and if you're really a skin conscious, then you have to choose your products only with professional help. So go to a dermatologist. It hardly takes a consultation. So the products will be the same. You have to anyways buy from here or there, whatever it is. It will just an extra consultation that you're going to pay to the doctor. But this is going to give you, lifetime good skin and without any issues specifically. So that is what I insist here. Yeah.
Absolutely. So the bottom line is that please go and consult a dermatologist. If you
Yes.
have a skin issue, definitely go to a dermatologist. Even if you don't have a skin issue as such, but still you want to understand your skin type, and the products that you want to buy, please go and consult a qualified dermatologist. Don't
And
fall
one more
prey to
thing,
those
there is
quacks.
lot of vagueness again. Where to go, whom to choose. So
Right.
qualified dermatology means a board certified dermatologist. In the sense, we study skin for 3 years. If it is MD, 2 years for if it is a diploma. So the proper degree you have to see, because quackery is very rampant nowadays. Now everyone wants to practice dermatology. So even non-medicals, non-doctors themselves project as cosmetologists. So choose your dermatologist wisely. This is very important thing.
Right. So choose your doctor very wisely and choose a doctor. Please go for a qualified and expert advice and contact a qualified dermatologist. Normally, we do a lot of, Googling or searching online for various products, various influencers. Rather than that, use the platform to search for a good qualified dermatologist near your place. That will actually help you. Now, Doctor, we were talking about the basics of skincare, especially for those who have an acne-prone skin. What should be the basics?
Yes. So before going into the basic skincare routine, first I want people who are watching me have to understand how to determine their skin type. So just in few lines, just in one small experiment which you can do by yourself. So in the night, before going to bed, just wash your face with any cleanser, whatever the cleanser you use, wash your face, go to bed with just fan on, windows open, no air conditioning, no heaters. Let the natural atmosphere be in touch with your skin. And next day morning, once you wake up, just watch yourself in the mirror. So depending upon your perception and what you see in the mirror, we can categorize broadly the skin type into 4 types. So if you have oiliness, a very oily sheen, and the moment you touch your skin, if you're able to, touch that oil, then your skin is oily. So in only particular T-zone, that is around the nose and around the mouth, in the forehead, if it is oily, the cheeks are dry, then it is combination skin. And you feel there is no any excess, there is no any oil production. It is just like normal. The way you slept, you just woke up the way, then it is normal skin. And you feel irritated and you feel dryness, and in some areas you feel a little bit of patchy redness and all, then your skin is sensitive. So this is a broader way of assessing your skin type. Or you can just do the same thing by washing your face, sit in a normal atmosphere and watch your skin after 1 hour. That also gives you an idea. Overnight or after 1 to 2 hours also will give us a basic idea of this thing. So once you know about your skin type, so oiliness is something which you will be having that excessive oiliness, and you want to wash your face. So this is a feeling what you get in oily skin. So coming to the skincare routine, any skin rather, what I suggest is CTM, that is cleansing, toning. I don't suggest, just to remember that is C and M, and next moisturization. So these 2 steps are very, very important. So depending upon your skin type, you have to choose a cleanser and a moisturizer. If you choose these 2 products in a right way and continue a skincare routine starting right from your 20s with a good sunscreen of which is specifically suiting your skin type, you don't have any issues on your skin, then definitely your skin health can be maintained as long as it can, as long as you don't have any other health issues, any hormonal imbalance. That is for a normal skin or an oily skin which is acne prone. But once again, your oiliness is so extensive, you started seeing the changes of the pimples with whatever may be the grade, then that is the time you have to consult your dermatologist to take the treatment for the acne. Because we don't want the acne to be there on your face, because it is an inflammation. It's basically, there is a lot of reaction happening when a bump comes out on your skin. So we don't want that to destroy your skin. If it is not treated in a right way, there is a possibility that it leads to scarring, because the inflammation has to be controlled. If it is not controlled, the underlying collagen is destroyed and you will be permanently left with acne scars, which we don't want. So that is very important. That is the reason I insist that you have to treat your acne. You cannot just leave it like that. If you leave it like that, you will subsequently land up in dermatology clinics for the treatment of acne scars, which we don't want to happen. Yeah.
Right. So these are the basic things. You need a good cleanser, a moisturizer, and a sunscreen as per your skin type and your working condition. Of course, sunscreen is related to that. We'll talk on it in detail later. But before that, doctor, now a very common, statement people will say, especially who have this acne-prone skin, is that acne skin is considered as dirty skin. So I need to wash my, face as frequently as possible. Plus, I have oily skin, so I need to wash my face as soon as possible, as frequently as possible. Is it true, or it's just a myth?
Yeah, that is, in a way it is true, but it should be the washing, the frequency and the intensity of the washing should be in such a way that it just cleanses the excessive oil. We don't want to destroy the underlying skin barrier, because whatever may be the problem, whether you're oily skin or normal skin, you have a normal skin barrier which has to be maintained in a right position. In the sense, the health of the skin barrier should be intact. But unfortunately, if you don't use a right cleanser, or if your cleansing is too harsh, or if you're using products which are too harsh for your skin, there is a possibility that you might strip the natural skin barrier. Because skin barrier itself is a very complex thing. It has some lipids in it, it has some proteins in it, and the structure is very complex. We want whatever is there to be in a right way. We want the natural oils of the skin to be intact. So this is one of common question patients are, how frequently you have to wash your face.
Mm-hmm.
So what I suggest to my patients is, even oily skin or any type of skin, washing twice a day with a proper cleanser should be fine. In between, if you feel that you need to wash, because in reapplications also we ask the patients to, reapplication of sunscreen, we ask the patients to wash their face. So if you feel there is a requirement that you have to get rid of the dirt and the excessive makeup or whatever you're using, then you can use the face wash more than 2 times also. But if there is no any extra necessity, twice a day should be sufficient. And also there will be a kind of proper way to use a face wash. It is just not like you wash your face, let the lather come, you wash it immediately. It's not going to work. Because in oil control face washes, we have medications, we have therapeutic molecules which are going to act on your skin. So you have to give some time for them to act. So take a little bit of face wash, applying all the quadrants of your face, lather it properly, leave it for 3 to 5 minutes, let it dry. And then rinse with the water. And again, what is the temperature of the water you use also is important. You need not use extremely hot or extremely cold. Lukewarm water should be fine. So this is one more important point. And if you feel there is a requirement, if you feel you have to wash your face, you can wash. Like whatever maybe the number of times with plain water also is fine.
Right. So this is why it's important, and to start with the cleansing part. And doctor, will also like to talk about moisturizer, because again, people who have oily skin or combination skin, they'll say that I already have so much of oil on my face. Why would I require moisturizer? What's the importance of moisturizer, especially for acne-prone skin?
Acne-prone skin, yes. So this is a very important question that you have to understand, that whatever may be the type of skin, moisturization is an extra thing. It's a luxury to the skin. You're trying to maintain the existing, already skin has some moisturization, which is called as NMF, natural moisturizing factor, which is already there in the skin. And the face being direct exposure to various kind of environmental changes, say it may be a hot sun or a hot air, a pollution, all these things are directly first going to affect your face. So it is even more important to take care of your facial skin than your body skin. So for this to happen, moisturization is very important in whatever may be the type of skin. In oily skin also you need a moisturizer. See, moisturizer is different from oiliness. Oiliness, you have to understand, it is basically sebum. Is a kind of, there is a special composition of the sebum, out of which the content, the fatty substances of the sebum are little inflammatory. In the sense, they have a tendency to damage your skin. They establish an inflammatory milieu there on the skin. So that has to be cleansed. And you need to moisturize already the inflamed skin. So you need to see for molecules which has anti-inflammatory properties in moisturizers. That is the reason you have specific moisturizer in market which is specific for oil control. So that is very important to choose. So what are the molecules that you have to look for? So usually tea tree oil has a property of hygroscopic nature, in the sense the sebum reducing property it has. And the aloe barbarensis, the aloe extracts, aloe vera extract also has a kind of oil control these things. And one more molecule called as bisabolol. It is an anti-inflammatory. So this also is a very latest molecule which is seen in acne prone moisturizers, where it has a property to decrease the inflammation. So these are few molecules which has to be seen in the contents of the moisturizers for oil prone skin. So it is a myth. Oil production in the oily skin doesn't require extra moisturization is a myth. It rather requires moisturizer with even more better properties and even more different properties.
Right. Thanks for bursting the myth. And, with sunscreen, again, people have the same, phenomenon or notion. They feel that, again, I have a very oily skin. Why would I need a sunscreen? Or I already have these acne. I don't want to layer it up with sunscreen. Even one of our viewer, Advik Singh, has the same question. His question is, can sunscreen aggravate existing acne or cause new breakouts? What's your take on that, doctor?
Yeah, once again, as I told you, choosing a right sunscreen is important. If the sunscreen is very thick, nowadays you have some mattifying and your tinted sunscreens, few sunscreens which are thick molecules. So there is a possibility that it might block your pores and it might be a reason for acneiform eruption. So choosing a right sunscreen is very important. Yeah. And what is the type of sunscreen that you have to choose also here? I want to give few tips to choose your sunscreen for oil prone skin.
Sure.
So already there are few negative points about sunscreen in users' minds, saying that if you apply sunscreen, I usually sweat a lot. The breathability of the skin goes away, and I feel like removing the sunscreen as soon as I can. I feel like washing it out. It increases my sweating so much. So these are the usual complaints we see. So that happens because of few molecules, basically silicone, some few important silicone molecules which has a occlusing property. But nowadays in market, there are very beautiful products which have removed these kind of problems. And also the type of sunscreen. Again, sunscreen is a very big thing. Just to understand that a complete sunscreen is a mixture of both physical and chemical sunscreens. Some typical chemical sunscreens has a tendency to irritate your skin also, has a tendency to increase that hotness when you apply on your this thing. Because sunscreens basically they absorb, they don't filter. So when rays are absorbed, there is a possibility of increasing the temperature and the feeling of warmth on your skin. So in acne prone skin, you have to use something which is not very thick. It should be non-comedogenic. Okay. And it need not have an extra hydrating component, because anyways you're using the moisturizing factor, which is oil controlling moisturizing factor. It should be mattifying, and it should be silicone based mattifying sunscreens are good, but again it should be light. Silicone preparation, it should be light, and it should, once you apply, it should not give you that casting effect, the white cast. So white cast is once again because of the physical component of it, which is titanium dioxide or zinc oxide. So these components give you the white cast. But again, there are a lot of new preparations in which the physical sunscreens are encapsulated, and you have some beautiful formulations in which this white cast is not there. So there are various things. Just to remember that you have to choose a light, mattifying, and silicone-based sunscreen to decrease that feeling of oiliness after application of the sunscreen. And one more important tip here is you can add this sunscreen with a topical powders, a talcum powder, say it may be, or it can be a compact loose powder or a thick compact stick, whatever it is. It can be recoated with powder. So that also will decrease the excessive oiliness, and thereby your skin doesn't make it more oily.
Wow, that's wonderful. Now with sunscreen, we know that the amount which we apply, the way of application and reapplication, they all play important roles. Please shed some more light over it, doctor.
Yeah. So coming to sunscreen application, this is also one more important point I insist, and I make sure my patient tells me back how to apply the sunscreen. That is the only way to assure from your side that they're using it in the right way. So here, there are a few tips. Number one, how frequently you have to apply sunscreen. See, whatever may be the best sunscreen or the costliest sunscreen, it's not going to give you 100% protection. It is only to some extent, and you need to add some physical sunscreen, physical measures like, hats or brims or using scarves and all to physically filter the rays. So this sunscreen has to be applied at least 15 to 20 minutes before you actually go into the sun exposed area. So whatever maybe your day is going to start. because it will take some time for the chemical sunscreens to settle on the skin and start acting. Physical sunscreen, yes, once you apply it's physically blocking, but it will take for some time for the chemical sunscreens to sit on the skin and for the action to be started. So duration before you apply, that is number one. Number two is how frequently you have to repeat. So 2 to 3, anywhere between 2 to 3 hours. 3 hours is what I tell my patients. You have to keep repeatedly applying the sunscreen, especially when you're outdoors. If you're indoors, if you're sure that there is no much of damage in the form of external lights, once or twice also is fine. But it has to be applied 3 times. Repeat every 3 hours when you're exposing yourself to this thing. And when before applying, also make sure you clean your skin. Try to wash it. If you're not able to wash it, at least wet mop it with a non-alcohol based swab, so that all the dirt and whatever the excessive product that is there on the skin is removed, and then again reapply. Third thing, what is the quantity that you have to apply? So if you take a sunscreen, you have to apply on 2 finger full. So this quantity is going to be sufficient for your face and neck. It has to be that quantity. Little bit of sunscreen is not going to help. So patients usually come up, I'm using sunscreen from such a long time, but my skin is not, the changes I'm not able to see on my skin. So this could be the reason. So these 3 points are very important before you understand how to use a sunscreen.
Fair enough. And doctor, treating acne is one thing. Treating the scar and pigmentation that those acne leave is another thing. And it's at times we feel that treating the acne scars and pigmentation issues caused by acne is more, difficult to treat. Now, my question is, using sunscreen even when we have acne, or taking care of our skin, especially for those who have acne-prone skin. Is it going to help to a certain extent to help us with those pigmentation formation or scar formation?
Yeah, so here also there are a few aspects where to understand what is the importance of using a sunscreen in acne patients and acne prone patients is. First one I want to discuss, in patients who are not having acne but they have oily skin. So these patients will present with a special condition called as seborrheic. In the sense, sebo is sebum, melanosis is pigmentation. So especially in the areas of excessive sebum production, the forehead part, around the nose, around the mouth, these people tend to have a lot of pigmentation, which is most commonly seen in men. Also in women we see, but it is because of the excessive oiliness, it's most commonly seen in men. So that particular thing is because of exposure of UV radiation over the sebum produced areas, which is leading to pigmentation. So this can be prevented by first controlling your oiliness and also using products which have already depigmenting products which to treat the already existing pigmentation. So this is one condition. So here the role of sunscreens is very important. If you use sunscreen, you can prevent this condition. That is number one. Number two, so people who already have acne, most of the acne treatments are superficial topical retinoids or oral retinoids and superficial peeling agents and oil reducing agents like salicylic acid and benzoyl peroxide, adapalene, topical retinoids. So these all the molecules have a tendency to photosensitize your skin. In the sense, when you apply these molecules and expose yourself to lot of sunlight without sun protection, you tend to pigment. The areas where you apply, there is a tendency of pigmentation. That is the reason essentially sunscreen becomes a very important part of the skincare routine in whom we are prescribing topical as well as oral retinoids also. Isotretinoin is a very frequently used medication in acne patients. Prevent yourself from the pigmentation as well as the sun related damage that can happen. So it is very important for the acne patients who are already on treatment to use a sunscreen in the morning.
Right. So sunscreen application is extremely important, especially if you have acne-prone skin or you have acne. Now, doctor, one more thing is a very common, tendency that we have. Whenever we see some acne, breakouts, etc., on our skin, we'll first run inside our kitchen for some quick fixes, some home remedies, or we'll ask a friend or family, or we'll go to the chemist for over-the-counter medication. We'll buy a tube. Won't even, care to look at the ingredients and will start applying those creams. Only when things go out of our control, only when we think a lot of, other things happening around those acne is when we go and land up in front of a doctor. Yeah. Now, I'm sure you have also seen many patients who already come with, worsening their symptoms. What's your stand on this? What's your advice for home remedies, over-the-counter medication, or asking a family or friend?
Yeah. So here two aspects I want to discuss. Number one, So there are few home remedies which are acne form eruption prone, in the sense using these products will cause acne on your skin. So you have to know very commonly used products, and most of the patients think, oh, is it? After discussion, this is the usual reaction from the people. Number one being turmeric. So in India, we have a tendency to apply a lot of turmeric just like that as a home remedy or some events or something like that. Turmeric being a thick molecule again, and that will block your pores and it leads to acne form eruption. The comedone eruption is so bad, you have to do comedone extraction multiple times for the pimples to settle down. So that is one thing. Second thing is the multani mitti, or the kind of scrubs that we use. There are few patients who have damaged the skin not knowing that multani mitti is going to make them glow. So that lead to once again a very bad acne form eruption, multani mitti. And people who have acne prone, some people also tend to react with steam to the face. So these three are very things you have to definitely stop doing if your skin is oily prone, skin acne prone. Second thing, if you already the pimples have formed and you are trying to do some home remedies, like most commonly there'll be application of some garlic and some irritants or like anti-inflammatory, once again turmeric. So these things also going to irritate the skin because it's a potent irritant. Once it irritates the skin, there is a tendency for pigmentation. So we don't want that to happen, because a pimple, even if you don't treat also, because of your body immunity, it goes away in few days, but it leaves a scar. And you're trying to meddle that already existing inflammation by irritant. So it is going to irritate and leave a pigmentation, which once again a different issue. We don't want acne, rather we got acne pigmentation also. And third point is people tend to prick. This is a very bad habit. They feel that once you prick, the whatever the material comes out, your pimple is gone. So this is a bad tendency what this thing is. And there is a special condition called as acne excoriae, in which pricking leads to pimple spots. So this pricking is once again stress related, because you can understand every girl who is acne prone in the teenagers must have undergone this kind of stress. A pimple is going to erupt just before periods, or you eat something which is very high glycemic, you tend to get pimples. So this stress once again increases the tendency of acne form eruption. So you need to control the stress, and counseling is very important, especially in teenagers, because they are very young to understand what's happening in their body. And it's very important to make them understand that you should not prick your acne, because it is going to cause one more issue rather than solving it. So this is one home remedy. So home remedies, I'm strictly no for home remedies. If you have some doubts, there are some things which I can tell you, some product based or like a little bit of lifestyle modifications can help you, but home remedies are not going to help you. Rather, they're going to make the thing worse.
And what about over-the-counter products or,
over-the-counter products also? Man, please don't ask me again. This is once again a very big issue. All the dermatologists, my colleague dermatologists all over the India must be very much, stressed out talking and listening about the OTC products. OTC products and acne, there is a very great association, because OTC skin products, which is given by a medical shop fellow, which costs 100 rupees, most of the steroid based creams, are very, very bad for your skin, because these contain very topical, very potent topical steroids, which has their own set of, damaging properties, like out of which acne form eruption is also very important. So people come up with so much of studded acne, all skin colored papules. So that is once again because of your topical steroids. So not only pimples, it will cause your skin to be damaged. It will, it will cut your skin. It will give you bad scars. It will make your skin very thin, and it will make your skin appear very red. That's called as telangiectasias. So there are a lot of side effects. So over the counter steroid containing creams is complete no-no, not only for acne, for anything. It should be only prescription based, dermatology prescribed medication for a steroid to go onto your skin. Second thing, OTC acne based products, there are a few these things, clindamycin based, you can once in a while you can try, but if it is not working, then you have to take a professional help and treat it in the right way.
Right. So big no for over-the-counter products. And, visiting a doctor can actually save your energy, your time, your money, and most importantly, your health, your skin. So please don't waste your energy, your money, your time, etc. on these over-the-counter products, or asking a family or friend, or taking their prescription and go and buy those, because we all are different. Our issues, our problems are different. So you need to get it diagnosed, and only a qualified dermatologist can do it for you. I'll quickly take some of the questions that our viewers have asked. So Kirti Kapoor is here. Her question is, should my child avoid certain foods or adopt a specific diet to improve their acne? Because many times we associate acne issue with food. Doctor, what's your say on this?
Yeah, there is definitely an association. So we don't want any food which shoots up the blood glucose levels. That is called as glycemic index. So every food has a specific glycemic index, out of which the most common foods that might increase your acneiform eruption are your sweets or chocolates, or like your cornflakes also is one thing which has a very high glycemic index. And fatty food sometimes, because of the nature of again more of junk food, all these things also. Dairy products also to some extent, but I don't completely ask my patients to stop dairy. Anything in limited quantity should be fine. So this is what I suggest. So just be watchful. Your skin only will tell you, your face, your acne itself will tell you that this particular food is not suiting you. So try to avoid that particular thing.
Mm-hmm. And as you were saying before, right, that this over-the-counter medication thing, the whole topic actually makes all the dermatologists and your fraternity stressful. There's one more question, and it shows that how obsessed people are with these over-the-counter products. It's, can you recommend any over-the-counter medication or topical treatments for my child's acne?
Yeah, so I need to understand what is the age of your child, Ms. Millie Agarwal. So, and also if it the grade of the acne. Over the counter acne medications, yes, I can tell you a few clindamycin based or niacinamide based products you can use without any harm. But again, I need to understand the age of the child and as well as the grade to prescribe any other kind of anti-acne medications. You can use some face washes for sure. 1% salicylic acid. If it is a mild acne, anything you can just read it by yourself in the ingredients, or tea tree oil based. And these things are going to help you. And there is a latest molecule called as lactosporin, which has an anti-acne property. That's a very latest thing. So if it is very mild, if you just want to just get rid of it, you can use over-the-counter anti-acne medications. Even if it is not medicated also, you can try using it. If it is not helping you, then you can take a medical help.
Okay. So we have Rahul Batswar with us. His question is, are there any lifestyle changes that my child should make to help manage their acne?
Yes, definitely. So we want everything should be in balance, so that whatever is happening because of their age should happen gracefully. So if your child is in teenage, whether it is a boy or a girl, ask them to get used to a healthy lifestyle where they are active. So like any kind of exercise which gives them real sweat, at least 5 days in a week, should be able to give a proper balance. I'm sure I don't say that complete acne will be disappearing because of exercise, but still, whatever has to happen will happen in a balanced way. So that is one thing, and avoid junk, and good sleeping habits, and also the kind of care you take in your bedding. So people, this is also one more important point where regular changing of your pillows and bed sheets also has a role to keep your atmosphere clean, so that the acneiform eruption is not increased. And we also see patients come up with specifically on one cheek they have a lot of acne, and because of the sleeping habits on one side. So general care about your daily these things also will help you to prevent that.
Fair enough. Rohit John is here. His question is, what causes acne in my child? Are there any specific factors that contribute to acne development?
Yeah, as we discussed in the beginning of the session, the age and hormones and your hormonal imbalance is one important factors. And just see if it is a female child, just see if she is having any PCOS issue or weight, hypothyroid. These are also associations for the acne. And basically oily skin, it's basically in your genes. So try to get assessed in a right way. What could be the reason? I'll be able to help you if I can see the patient in live. Yeah.
Right. So the bottom line is consult an expert, consult a qualified dermatologist. Don't fall for quacks, over-the-counter medication, etc. Go to the right person. It will save your, various things and your health, which is more important. And before we sum up the whole session, Dr. Deepthi Prasad, any take-home message for our viewers?
Yes, definitely. So here the topic today we want to stress is usage of sunscreens in acne. So first, try to assess your acne, the severity of the acne, and take a right treatment. And sunscreens are definitely has a great role, because at the end of the day, we want the acne to be healed in the right way. We don't want any pigmentation, and whatever the after effects of usage of anti-acne medications also should not harm your skin. So to prevent pigmentation, to keep your skin the way it is, to prevent the excessive dryness, all these things, usage of sunscreens is very, very important. Not only in acne, but rather in as a skincare routine, which is an essential component of your skincare routine. Just don't skip your sunscreen.
Thank you so very much, Dr. C.H. Deepthi Prasad. It was wonderful listening to you. Thank you for your valuable time, and it has been a very informative session. And we really look forward for many more such sessions in coming times with you. Thank
I
you.
would love to come back for sure. And Samyukta, thank you so much. You made my session very easy. You're very
Pleasure.
proactive to extract the information. I'm really thankful for that.
Thank you so very much, Doctor. It was a sheer pleasure. And viewers, thank you for your active participation, and stay connected to our beautiful Spotless Skin page. Thank you. Stay healthy, stay beautiful, stay spotless, and keep glowing. Goodbye. Have a good day ahead.